So I think that most people understand what PSMA is as a cell surface antigen, which we use as a target both diagnostically and therapeutically. I think most people are aware that there are some radiolabeled anti-PSMA compounds, mostly small molecules, so either PSMA-11 or DCFPOL for diagnostics, or PSMA-617 or INT, that have been used for therapeutics, most often radiolabeled with 177 lutetium, which is a beta emitter, beta and gamma. What people may not realize is that antibodies have been used for a lot longer and are being developed a lot for PSMA-targeted alpha emitters. I think that the reason that the first two trials, prospective trials, have used antibodies is because of their biodistribution, which is largely avoiding some of the PSMA expressing non-tumor areas such as parotid and salivary glands, lacrimal glands, kidney, and small bowel. At least that's what we see by imaging and dosimetry studies. So in any case, this was a phase 1 dose escalation and dose expansion study of actinium-225J591, so a powerful alpha emitter in actinium-225, and J591, which is an externally binding, internalizing a monoclonal antibody against PSMA. The initial dose escalation results were presented last year. Essentially, it was patients with metastatic CRPC following potent AR targeted therapy and chemotherapy unless they were ineligible or refused chemotherapy. The dose escalation part had 7 cohorts. We went up to all 7 cohorts. There was 1 DLT in cohort 6. Which was anemia and thrombocytopenia, but none, 0 to 6, in cohort 7, which was 93.3 kilobecquerel per kilogram. So that dose was expanded, and we're presenting the entire phase 1 plus expansion at ASCO. Basically, it was a total of 32 patients. There was no pre-selection for by PSMA PET, although those that had PSMA PET generally had at least 1 lesion that showed some uptick. Could have been a little bit, it could have been a lot. And prior PSMA-targeted therapy was allowed. So basically, we demonstrate overall, this is primarily a safety study that was overall safe. So in addition to that 1 DLT, there was some additional adverse events, but mostly restricted to grade 1 and 2. So grade 3 and 4 adverse events were, generally speaking, reversible myelosuppression, the thrombocytopenia, anemia, or neutropenia in a handful of patients. And then 4 out of the 32 had transient grade 3 fatigue, but the rest were grade 1 and 2, and that includes a minority with dry mouth or xerostomia, which is a problem for PSMA-targeted small molecules, and potentially a major problem for PSMA-targeted alphas using small molecules because of the sensitivity, radiosensitivity of the salivary glands. We saw about a third, it was 37%, that had grade 1 xerostomia. Most of those that had xerostomia had prior lutetium PSMA. So there may be some additive effects. And then despite no selection for PSMA, the majority had some PSA decline, with about 44% having a 50% PSA decline. We had about 2/3 that had circulating tumor cell counts before and after, and about 3/4 had control, meaning half of those had drop, half overall had drop, and another quarter had stability at undetectable. And then it's small numbers, admittedly, but the PFS, which is mostly biochemical PFS, after a single dose of the drug was about 5 months, which is pretty good, and overall survival 11 months. So that first-in-human study we conclude is successful. It appears that that single dose is tolerated. It has some preliminary efficacy. So we've now moved on to some additional studies, either 2 doses in a fractionated fashion, like we've done with lutetium, multiple kind of more traditional dosing, moderate dosing every 6 weeks, a retreatment study where patients have been treated before and then at some point later progress and can get PSMA-targeted radionuclide therapy again. I think that's especially pertinent given the results of the VISION study, which will be presented. And then a couple of combos. One combo that is both antibody as well as small molecule, alpha and beta combinations, as well as a combination with pembrolizumab and AR signaling inhibitor. That's actually a randomized trial. It was very nice to finish the study, and thanks to PCF, Department of Defense, NIH through our SCORE, and philanthropy for really helping us get the study done. It's nice to see that was done, and now is led to additional studies.